How does subchondral bone cause osteoarthritis bone spurs? Imagine your joints as busy cities where bones, cartilage, and tissues work together smoothly. When something goes wrong in the city, it can cause pain and changes in the landscape. One of these changes involves the layer of bone just beneath the cartilage, called subchondral bone. This layer plays a big role in the development of bone spurs during osteoarthritis. In a healthy joint, the cartilage acts like a cushion, absorbing shocks and allowing smooth movement. Over time, with osteoarthritis, this cartilage starts to wear away. As the cartilage thins and breaks down, the bones underneath are exposed to more pressure and stress. Think of it like a road that loses its pavement and starts to crack and become uneven. The subchondral bone responds to this increased stress by trying to adapt. It begins to remodel itself, which means breaking down old bone and building new bone. This process is meant to strengthen the joint, but in osteoarthritis, it often becomes abnormal. The bone can become thicker and denser, a condition called subchondral sclerosis. The bone's structure also changes, with the collagen fibers becoming disorganized and mineral deposits altering. These changes make the bone less able to absorb shocks, so the joint takes even more damage from everyday movements. As the cartilage continues to deteriorate, the body tries to stabilize the joint by forming bone spurs, also known as osteophytes. These are small, bony projections that grow along the edges of the joint. They develop because the body's cells, called osteoblasts, are stimulated by abnormal forces and inflammation to deposit new bone in areas where it normally wouldn't. Inflammation is a key player here. Chemicals released during osteoarthritis, like prostaglandins and interleukins, can increase bone breakdown and also encourage new bone growth. Changes in signaling molecules, such as transforming growth factor beta, also influence how both bone and cartilage behave. All these factors together push the body to grow bone spurs as a way to try and stabilize the joint. However, these spurs can cause more pain and limit movement. They can also irritate surrounding tissues and lead to further joint damage. Understanding this process shows why treatments that reduce joint stress and inflammation, like weight management, physical therapy, and medications, can slow down bone spur growth. In some cases, surgery might be needed to remove these spurs or realign the joint to improve function. So, in simple terms, subchondral bone causes osteoarthritis bone spurs by trying to adapt to increased stress and damage. Its abnormal remodeling and response to inflammation lead to the growth of these bony projections, which are part of the body's attempt to protect the joint but often end up causing more problems. Recognizing this process helps us understand why osteoarthritis progresses and how treatments can help manage it.